In December 2021, Japan hosted the Tokyo Nutrition for Growth Summit 2021 and announced a commitment towards further improving nutrition in the future. As part of its commitment at the Tokyo Nutrition for Growth Summit 2021, Japan has highlighted that further promoting Japan's nutrition policies for leaving no one behind, which is the foundation of a sustainable society throughout the life course, as an important part of universal health coverage. This commitment specifically identifies excess sodium intake, underweight among young women, and nutritional disparities caused by economic conditions as nutrition issues that need to be addressed. Additionally, various stakeholders, including the government, businesses, academia, and civil society, will collaborate to tackle these challenges. Since the late 1800s, Japan has been undertaking nutrition-related activities, and throughout the history of the country's nutrition policy, diets, specialists, and evidence have always been the core elements. After World War II, Japan promoted various nationwide nutrition improvement activities, for instance, the National Nutrition Survey, school lunch program, and nutritional guidance in local communities, even before the economic development, as the essential core of public health. In addition, Japan has developed nutrition policy to tackle nutrition challenges for each era and has been leading to the top level of longevity in the world. Japan not only promotes nutritional improvement for all life stages, but also works on nutritional management for the sick and wounded and support for nutrition and dietary habits for disaster victims, promoting the nutrition policy in Japan to leave no one behind. To achieve these efforts, the presence of specialists such as registered dietitians and dietitians, as well as volunteers such as volunteers for promoting improved dietary habits, is essential in various fields and sites throughout the country. In Japan, education for nutrition professionals has been conducted since before World War II. Then, in 1947, the Dietitians Act was enacted to codify the training of dietitians. Based on the act, registered dietitians and dietitians are placed in various fields throughout Japan to promote nutrition improvement activities. In Japan, registered dietitians and dietitians have been placed in various facilities related to the nutrition of the population, such as local governments, preschool, schools, medical facilities, and elderly care facilities. They work together with other professionals to address nutrition improvements tailored to the characteristics of the target population. In addition to nutrition professionals such as registered dietitians and dietitians, Japan also has many volunteers, such as volunteers for promoting improved dietary habits, working towards improving nutrition in their communities. As members of our organization, Volunteers for Promoting Improved Dietary Habits work to promote better eating habits and expand the circle of community health by promoting better eating habits among local residents. As of 2021, there are approximately 110,000 people nationwide who are active in this role. Volunteers for Promoting Improved Dietary Habits work in collaboration with municipalities to support nutrition and dietary habits improvement activities in their communities, with the slogan, "Achieve our good health ourselves." Now we will introduce pioneering examples of Japan's nutrition improvement initiatives, which are being tackled through collaboration among diverse stakeholders. In Koga City, Fukuoka Prefecture, starting from April 2022, as part of a sodium reduction effort, newlyweds who submit their marriage registration are being given measuring cups and recipes for low sodium menus. This program was planned through close cooperation between the city's registered dietitian and public health nurse, and was implemented by the Health and Care Division with the cooperation of the Citizens Division. One characteristic of this program is that it targets adults and working age individuals who are difficult for local governments to reach. The timing of marriage, which changes one's living environment, is seen as an effective awareness-raising opportunity to encourage changes in eating habits. In Sanjo City, Niigata Prefecture, since 2015, efforts have been made to raise awareness of sodium reduction through citizen surveys on sodium intake group health checkups, and community gatherings. In addition, they are promoting an invisible sodium reduction strategy, in which low-sodium prepared foods that do not have low sodium labeled are sold at local supermarkets. As a result of these efforts, in 2020, survey on sodium intake, which included urinary sodium measurements and questionnaire on citizens' lifestyle, showed improvement in 8 out of 11 items compared to the 2015 survey asking participants about their dietary habits. Furthermore, there were also voluntary sodium reduction efforts taking place at local supermarkets, indicating a positive impact of the campaign. In 2022, there will be quantitative evaluations of the effects of these efforts, such as conducting surveys and measuring urinary sodium concentration levels. In Hachimantai City, Iwate Prefecture, the Municipal Health Maid Council and the after-school care clubs that are established throughout the city are collaborating to support healthy living from the school-age period through food education. Through this initiative, they aim to promote understanding and practical application of proper dietary habits through experiential learning such as cooking classes. In addition, this initiative also provides an opportunity for children and volunteers for promoting improved dietary habits, to interact between generations and pass down local cuisine traditions. As a result of these efforts, the percentage of children with obesity tendencies has decreased, and the percentage of children who perceive low-sodium miso soup as weak has also decreased. In Yamato City, Kanagawa Prefecture, the Health and Beauty Project is being promoted to address the issue of underweight among young women. This project aims to change the mindset that being thin is good and provides individual nutritional counseling on diet and other related topics through partnering with obstetricians and gynecologists. This initiative is not limited to adult women, because through collaborating with the city's Board of Education, the Health Promotion Division is also reaching young people by creating opportunities to think about underweight as they share the content of the initiative to prefectural high schools and middle schools. In addition, the project is characterized by its collaboration with a university to seek advice on the plan and implementation process. Furthermore, to get the attention of many young women, they also made public awareness stickers. Much thought and consideration went into the design of the illustrations and posters. It is a unique project in how the Health Promotion Divisions collaborated with the Cultural Promotion Division to create promotional materials by engaging the winners of the city's illustration contest. Komatsu Limited is a Japanese manufacturing company that mainly produces construction and mining equipment. Komatsu Limited is working on improving the food environment by encouraging health literacy among employees and diet improvement. To promote these initiatives, Komatsu shares employees' health issues with the food service company and collaborates with them to solve these issues. For example, since different job types require different levels of physical activity throughout the day, they increase the variety of healthy meal options to cater to diverse employees. They also deliberately provide healthy meals without emphasizing their health benefits and modify dishware and presentation to encourage employees who are less interested in healthy meals to choose them. As a result of these efforts, some workplaces have achieved a 20% consumption rate for healthy dishes, and healthy meal options are becoming more popular choices. These initiatives have also contributed to increasing employees' health awareness, with some requesting recipes to cook healthy meals at home. In Hyōgo Prefecture, a frailty prevention and improvement program has been developed for municipalities throughout the prefecture, and support for frailty measures in municipalities is being carried out through collaboration between businesses, academia and government. As part of this initiative, municipalities are also collaborating with meal delivery services providers to provide healthy promoting meal delivery services at community gathering places where seniors in the community can gather and interact. As a result of these efforts, improvements have been observed in program participants' food intake diversity and subjective health perception. In Gosen City, Niigata Prefecture, the Health and Welfare Department, the Children's Department, and the School Education Department's registered dietitians and the Disaster Prevention Department are collaborating to examine the nutritional and dietary support in the event of a large-scale disaster and promote efficient management and use of stockpiled food. To promote food stockpiling for large-scale disasters, they are using the simple simulator for calculating nutritional food stocks in preparation for large-scale disasters, which is published by the Ministry of Health, Labour and Welfare. This helps them prepare for nutritional and dietary support that considers the health and nutrition of residents as well as the needs of infants, the elderly and residents with food allergies. As a result of these efforts, they have improved collaboration with related agencies, and they are promoting community-based efforts such as utilizing unexpired stockpiled food as educational materials for disaster prevention in nurseries, schools and community gathering places where seniors in the community can gather and interact. In Japan, registered dietitians and dietitians in various fields and workplaces take the lead, and diverse stakeholders collaborate to implement nutrition improvement initiatives throughout the country, leaving no one behind. As seen in the example introduced, nutrition improvement policy in Japan, which is based on the three important elements of diets, specialists and evidence, can be a reference for other countries and regions. Japan aims to contribute to the resolution of nutrition issues and ultimately the realization of a sustainable society by sharing the experience of over 100 years of nutrition policy with the world.